I do want to know more about your work with neurodegenerative diseases in general. So I know you have extensive knowledge and experience with these as well as rare diseases. So can you talk a bit more about areas you've worked in and how they might complement the work that your group is doing with ALS?
Sure. Well, I've always been a mouse geneticist at heart. In graduate school, I cut my teeth on epilepsy, and so I worked in areas of absence epilepsy and mouse models of absence epilepsy. If we fast forward many, many years into the era of spinal muscular atrophy, I will say I think that was really the disease for me that sort of framed what I feel is a successful roadmap or an infrastructure, if you will. I think it really starts with the mouse models, making sure that we have good mouse models. Most importantly, making sure they're available to the scientific community. Spinal muscular atrophy is a neurodegenerative disease. It's a motor neuron disease. It very much mimics some of the disease progression of ALS, but more horrifically, it happens in young children and in babies. And so the counterbalance to SMA and ALS is that SMA is the most common form is a single gene mutation. And so our ability to model that disease in mice was I'm going to say, maybe a little bit more straightforward because it was only one gene that we were looking for. But we did have challenges in modeling the various forms of SMA. I'm happy to say that SMA is one of the biggest success stories, I think, in neurodegenerative diseases, with many FDA-approved therapies out there now. I believe there's 3 with Roche coming online. And so I think it is a really good success story. And again, at the heart of that success is the infrastructure and the resources that help you get to those therapeutics. And we're really hoping that with ALS, we can use that same sort of that infrastructure to try to make some progress into therapeutics for this disease as well.